Many wonder how plastic surgery got its name. Plastikos is the Greek word meaning to mold or give form, and plastic surgery is the specialty that deals with restoring or giving shape to the body. There are two subspecialties within plastic surgery: cosmetic and aesthetic surgery, restore or reshape normal functions of the body to improve appearance and hopefully self-esteem. Reconstructive surgery treats abnormal structures of the body related to birth defects, developmental problems, disease, or injury to restore function and correct disfigurement and to hopefully also improve self-esteem. Please review the outcomes for this chapter. The skin is the largest organ of the body, and its derivatives, hair, nail, sweat, and oil glands, make up the integumentary system. The functions of the skin are to protect the underlying tissue and organs, excrete organic waste and store nutrients, excrete water and dissipate heat, and transmit touch, pressure, pain, and temperature, which can alert the body to possible injury. The epidermis is the very thin outer layer of the skin, and it contains 5 sublayers. The dermis lies directly beneath the epidermis and above the hypodermis. The dermis contains all the accessory structures such as nerves, blood supply for the skin, hair follicles, and sebaceous and sweat glands. The hypodermis is the deepest layer and is the subcutaneous fatty layer. Many patients will seek treatment for skin cancer. The most common is basal cell carcinoma, or BCC. The second most common is squamous cell carcinoma, or SCC. Melanoma is the rarest form of skin cancer, but also accounts for the most fatalities related to skin cancer. Signs of skin cancer are asymmetry, border irregularities, color, and diameter. Skin cancer can be excised for diagnosis or as a cure. Usually with excision, the area can be closed, but sometimes a skin graft must be done. When sending a specimen, the surgeon may ask for a stitch to mark the lesion, usually a non-absorbable suture. Another method of excision is Mohs surgery, and this is usually performed in a dermatologist's office and can be a lengthy procedure. The doctor will remove very small areas of the lesion at a time and have them tested before any more tissue is removed. The purpose is to preserve as much healthy tissue as possible. There are several external sources that can cause burns. Heat causes a thermal burn, and radiation, some chemicals and gases, and electricity can all cause burns. The rule of nines is a common way to assess the body's surface area affected by burns. This is a way to state the percentage of burns. So if the head, both arms, and chest are burned, the patient would be said to have 45% of his or her body burned. First-degree burns affect the outer layer of the skin, the epidermis, causing pain, redness, and swelling. An example of this is a typical sunburn that most of us have experienced. A second-degree burn, also referred to as a partial thickness burn, affects both the outer and underlying layers of skin, the entire epidermis, and just a portion of the dermis. This type of burn also causes pain, redness, swelling, but blisters are also present. Third-degree burns or full-thickness burns involve the epidermis, entire dermis, and subcutaneous tissue. This type of burn extends into deeper tissue, causing blackened skin, or eschar, or a pearly white that may be numb. Not everyone uses the term fourth-degree burn and will stop the classification at third degree. But if fourth degree is used, it means that muscles, bones, and tendons have been exposed and injured. This deep burn may require amputation. There are many complications associated with burns. Some of them include hypothermia, fluid and electrolyte imbalance, infection, inadequate nutrition, respiratory deficit, vascular damage, contractures, and deformity.